You're a HIMSS Davies Award-winning pediatrician. You've been instrumental in the state of New York during the Regional Extension Center / Meaningful Use Days, helping practices and organizations go digital. And you've consulted with many organizations around patient privacy, data security, digital practices. So, though you're not a cybersecurity expert per se, you have many areas of expertise which touch on that. In your experience, what would you say is the biggest flaw or area of risk when it comes to protecting healthcare data?
The breaches that I get called on and been involved with are internal. Employees still goes on, right? There are less attacks on hardware and servers than we think. And there's many of the breaches are happening internally.
So when you're initially talking to practices or other healthcare organizations, where does your advice start?
They're very practical. They're not sharing the passwords. Does everyone have a unique password at that organization? Or are they just using a generic Doc Alexander practice? We'll use this one that's shared. I mean, that right there would be like, whoop, whoop, warning bell, right? You can't know who's coming in. Everyone having a role assigned. So role assignment, unique passwords. I hope I've seen that improve over time. Sometimes you had to hammer people home, not have the sticky note with the password sitting up on the screen. Backups. One of the reasons people like to go to quote unquote cloud-based is let my vendor handle all the backups, as opposed to when I have a server on site and I'm responsible, unless again I'm giving someone access to come in and back that up. So we don't hear as many stories as we used to about everything crashed and I didn't have it backed up. Even the vendor that most recently had the ransomware attack, the reason they were able to get back up is because they had backup. Some of this stuff is still very practical. You don't need to be if you know you're in a VPN and you're encrypted, that's good if you look at the whole 7-layer of the internet protocol. You don't need to know all of it, but you need to know the basics, and that's where people are getting hung up.
It sounds like you're talking about some pretty fundamental stuff.
You would be amazed at just how basic it is. People were doing this download. They're like, we need a HIPAA security manual. And they would just download one from the internet and put it on a desk and say, there we go, we have it. And if you read through it, it didn't have anything to do and match the organization. So if there's a breach and you have to hand your HIPAA security manual over to OC, right? Yeah. You're going to be like, what? The Office of Civil Rights, they're going to look at this. They're going to go through it and say, do you do this? Your manual says you do it. So you have to have a couple things. If your manual says you do it, did you train your staff in it? Show me the training materials that you train your staff that, right? And then show me the logs that said I followed through with all that. So that's what they're going to look for. I have to have a policy, I have to have training, and I have to have documentation that I followed through on it. And if those don't match, then you're looking at fines.
Maybe basic, but it sounds like it requires some commitment and effort.
It takes time. It's tough, and I think that's part of, if you look at physician burnout, small practices leaving, that's just one of the regulatory requirements. It's quite onerous. To do the initial one and do all the inventory and all the logs, I mean, initially, that's probably 12 hours of work. And then annually, to keep that up, that's a couple days work for somebody.